Have you ever been told, "We're going to carry out a mental capacity assessment"? For many families, hearing those words can be frightening. People often think it means someone is about to take away their loved one's independence, or that a diagnosis such as dementia automatically means they can no longer make decisions for themselves. But that's not how it works. In fact, mental capacity assessments are designed to do the exact opposite. They're there to protect a person's rights, not to remove them. Today, I'm going to explain what a mental capacity assessment actually is, why they're carried out, who completes them, what questions might be asked, and what happens afterwards. By the end of this video, you'll hopefully feel much more confident if you or someone you love is ever asked to have one. So let's start with the basics. Mental capacity simply means a person's ability to make a particular decision at the time it needs to be made. Notice something important there. It's about a particular decision, not every decision, not forever. Just that specific decision at that moment in time. Someone may be perfectly capable of deciding what they'd like to eat for lunch, but they might struggle to understand complicated financial paperwork. Equally, someone recovering from an infection may temporarily become confused. Once they're well again, their ability to make decisions may return completely. Mental capacity isn't an all or nothing label. It's much more individual than that. The 5 key principles. In England and Wales, mental capacity assessments are guided by the Mental Capacity Act. The law is built around 5 important principles. The first is that every adult must be assumed to have capacity unless it's shown otherwise. Nobody should be judged simply because of their age, a disability, a diagnosis, or because someone else thinks they're making a poor decision. The second principle is that people should be given every possible support to make their own decisions. That might mean using simpler language, giving information in writing, using pictures, having someone they trust present, or choosing a quieter environment. The goal is always to help someone make their own decisions wherever possible. The third principle often surprises people. The law says that people have the right to make what others consider to be an unwise decision. Making a decision that other people disagree with doesn't automatically mean someone lacks capacity. We've all made choices that others wouldn't have made. The law recognises that. The fourth principle is that someone genuinely lacks capacity for a particular decision. Anything done on their behalf must be in their best interests. And finally, the least restrictive option should always be chosen. In other words, if there are different ways of supporting someone, the option that gives them the greatest freedom should usually be considered first. So when is an assessment needed? Mental capacity assessments aren't carried out routinely. There usually needs to be a genuine reason. For example, someone may need to decide where they live after leaving hospital, whether they agree to medical treatment, whether they can safely manage their finances, or whether they're able to understand risks associated with living independently. Sometimes social workers, nurses, doctors, or occupational therapists notice concerns during their work and decide an assessment would help clarify whether additional support is needed. Now, does dementia mean someone lacks capacity? This is probably one of the biggest myths. The answer is no. A diagnosis of dementia does not automatically mean someone lacks capacity. Many people living with dementia continue making many of their own decisions for years. Capacity can also fluctuate. Someone may have better mornings than afternoons. They may become more confused if they're unwell, or they may understand one decision perfectly while they're struggling with another. Each decision has to be looked at separately. So what happens during the assessment? One question families often ask is, what are they actually going to ask? The assessment usually feels more like a conversation than an exam. The professional carrying it out wants to understand whether the person can understand the information relevant to the decision, retain that information long enough to make the decision, weigh up the pros and cons, and communicate their choice in some way. Communication doesn't always mean speaking. Some people use writing, gestures, communication aids, or other methods. The assessment should always be carried out in a way that gives the person the best chance of showing what they understand. So, who carries out the assessment? There's another common misunderstanding. People often think a judge or a specialist has to be involved. In reality, the assessment is usually completed by the professional involved in the particular decision. That could be a social worker, a doctor, a nurse, an occupational therapist, or another trained professional. Who carries it out depends on the type of decision being made. So what if someone lacks capacity? If the assessment concludes that someone cannot make that particular decision, it doesn't mean they've lost all of their rights. Instead, the decision moves into what's called a best interests process, or best interest meeting. The person should still be involved as much as possible. Professionals should consider the person's wishes, their beliefs, and their values. Any advanced decisions they've made, and the views of the family members and others who know them well. The aim isn't to make the easiest decision. It's to make the decision that best reflects what the individual would have wanted if they had been able to decide for themselves. So how can families help? If your loved one is having a mental capacity assessment, there are several ways you can support them. Choose a time of day when they're usually at their best, if possible. Reduce distractions. Bring hearing aids or glasses if needed. Allow extra time. Avoid answering questions for them unless asked. It can feel natural to jump in and help, but giving your loved one time to answer themselves may give a much more accurate picture of what they can do. Your role is to support, not speak on their behalf unless it's necessary. So what are the common myths? Let's quickly clear up a few common myths, shall we? Myth number 1. Mental capacity assessments take away people's rights. Actually, they're designed to protect those rights. Myth number 2. Everyone with dementia lacks capacity. False. Many people continue making their own decisions for a long time after the diagnosis of dementia. Myth number 3. Someone either has capacity or they don't. Again, not true. Capacity depends on the specific decision and can change over time. Myth number 4. Families make the decision if someone lacks capacity. Not automatically. Professionals have legal responsibilities, although family members should usually be involved in best interest discussions where appropriate. So some final thoughts. Mental capacity assessments can sound intimidating, but they're one of the most important safeguards we have. Their purpose isn't to take control away from people. Their purpose is to make sure people keep control wherever they possibly can. If someone can make their own decision, that decision should be respected. If they genuinely can't, the law provides a framework to make sure decisions are made fairly, carefully, and with dignity. Understanding how the process works can remove a lot of fear and uncertainty for families. If you found today's video helpful, please consider subscribing to The Care Frequency, where I explain social care in plain English to individuals to help them and carers and families make informed decisions with confidence. If there's a social care topic you'd like me to explain in a future video, leave it in the comments below. Thank you so much for watching. Take care of yourselves, and I'll see you in the next video.